director at the Indo-American Chamber of Commerce. Today we have organized webinar on COVID-19 and global eye health with emphasis on Indian and American scenario in association with Aditya Jyot Eye Hospital Private Limited, National Eye Institute and Organized Medicine Academic Guild. Before we get started, I would like to request you all that if you have any questions during the presentation, please type them into the question box in your control panel. We will collect these and address them at the end of the presentation. Now, without any further delay, I would request Ms. Rajalakshmi Rao to address the participants.
Friends in US, good morning. And friends in India, good evening. Welcome to this webinar. It gives me great pleasure to welcome all of you and all those participants who have already come in to hear about what you all have to say, organized by Indo-American Chamber of Commerce, COVID-19 and global eye health with emphasis on the Indian and American scenario. I think everybody wants to know what's happening, not just in India, but what's happening in US, because it's always US is the research place which brings in the best into the world. And we today have supporting partner, that is Aditya Jyot Eye Hospital Private Limited, National Eye Institute, and Organized Medicine Academic Guild. For the benefit of illustrious listeners, I need to tell about Indo-American Chamber of Commerce. We are completing 52 years of being there. And during these years, we've started 10 branches. And we have 2,000 members across the country in mostly industry and various areas, be manufacturing, textiles, or telecommunication, everything. All our members are varied in all these 10 branches. We have in Bombay, Mumbai, Delhi, and Kolkata, Chennai, Bangalore, Hyderabad, and Cochin, Varanasi, Pune, Calcutta. Yeah, I got them all, 10 of them. And so we have a lot of regional work across the country. And this particular series we've started now, and yours is the very first one, is the annual conference series. And this is the very first one we are starting with a bit of a noble cause about giving vision to people and helping people with vision. And that's how we started. And the rest of them are all in banking, insurance, and legal, pharma, various other areas. But coming back to what ISSC does, we normally help all the MSMEs and hold their hand to see that they have all the help with the government agencies and also with any problems with US. And luckily, all the stakeholders, which is our own industry corporates, and also the consumers and government agencies, we have a help from US consulate, always, and Preeta is the example here. And we have Invest India, who's actually holding our hand through all our programs and giving us the connect with all the departments in the government of India. So that is how we have been doing a lot of work of late. And this is what I have to talk about ISSC. And now this one particular one, we have decided to tie up with Dr. Natarajan, who has an amazing background and the right person to connect all of you to this program. And I'm really extremely happy that he's our member and also is a convener of this program. And before I go ahead with anything else, before I introduce him, let me just mention to the participants, we have amongst us wonderful people who are all got together in a very short time to take up this particular cause we've taken. Dr. Gyan John Prakash, Director, Office International Program Activities, Associate Director, NH National Eye Institute at NIH, NEI, USA. And believe me, friends, there has a lot of giveaways for all of you if only you try and connect with him, because he can actually give a lot of grants to whoever are needy in research areas. He will talk about it later, so don't miss anything that he says. Dr. Preeta Rajaraman, U.S. Health Attaché, India and Regional Representative, South Asia, Office of Global Affairs, DHHS. Welcome, Preeta. You have been with us earlier and big help for Indo American Chamber. Mr. Michael Chitu, Fogarty International Center, National Institute of Health, NIH, USA. He is amongst us, and he says he has been in India many, many times, and and I'm happy to have him at least on webinar now because he cannot travel to India. Welcome, Michael. We are going to get Mr. Bhavani Rani at a later stage. I will welcome him when he comes in. And then I go to Mr. Dr. Ravi Goel, instructor, Wills Eve Hospital, USA. Thank you very much, Dr. Ravi, for joining us. And now we need to talk about our Dr. Natarajan, the person who's put it all together, and a man with a golden heart. Dr. Natarajan, his small background I'm giving, and I think you all know, but still for the participants, I have to say this. Dr. Natarajan is awarded with Padma Shri by the President of India. He is President of Asia Pacific Ophthalmic Trauma Society, APOTS. If I just say APOTS, people will say, what are you talking? So I have to read the whole thing. And Organized Medicine Academy Guild with 20 medical organizations, that is OMAG. Immediate past president of AIOS, All India Ophthalmological Society president, and the president Shankar Nethralaya alumni, and Board of Trustees International Council for Ophthalmology, ICO, Secretary General Asian Eye Genetics Consortium, Chairman and MD Aditya Jyot Eye Hospital Private Limited, specialized in vitreous, retina and macular surgery, and managing trustee Aditya Jyot Foundation for Twinkling Little Eyes, that is an NGO. And I have seen over the years, this is of course, I'm just reading what is on his website, I'm sure, but what he has been doing something extraordinary. He's doing from his heart. There's nothing to do with earning anything. It's just the passion to help people. I mean, he has touched 800 million people in slums just on his own without any help from the government or anyone. And he started having awareness camps, covered 200,000 slums in Mumbai. And actually, he's been sending bikes with taking photos of people who would not come anywhere, the ladies, women who are stuck in the slums. He would do all these things. I was like surprised how he's doing so much work. And he also helped people in Kashmir when when there were this blasts were there and gunshots and all. A lot of splinters went into their eyes. A lot of children, people, and they had a lot of issues. He especially went there at his own cost and did all that work and came back. Helped a lot of them with surgeries and brought some people free of cost and kept them in his hospital and treated them. This is a personal knowledge I have because I've seen it. So all these things he does behind the, what we all know otherwise. So that is the goodness of this man. And this particular 2 weeks are supposed to be declared by Government of India as the eye donor donation week or something it is called. And he has convinced Mr. Bhavani Irani, who believes in such social causes. He's going to join us later. And his thing, he's an actor. He's not a doctor like you to talk about medical subject. But he's going to tell all of us that we should donate and our vision to people who can get some benefit of it. I did some years back when my mother had a cataract surgery, and I know I have donated at that time, and I really would want all of you participants to think of it, not during COVID time, but whenever you can. So with this small introduction of Indo Chamber of Commerce, can I now lead to the hands of Dr. Natarajan to start the whole thing and bring in all our participant families.
Thank you, Raja. Thanks a lot for this opportunity, and I thank God for allowing me to serve the people, and that's my pleasure. And as you rightly said, serving from the heart. So I will quickly share the screen. So can you see the screen? No. Yes.
Yes, you can see.
Yes. Okay. Yes. So thanks to Raja and the Indo-American Chamber of Commerce, I'm happy I'm a member of the Indo-American Chamber of Commerce and joined the related webinar on the COVID-19 and global eye health with an emphasis on the Indian and American scenario. So we have the, as Raja mentioned, and we have NIH with us, and we have Dr. Ravi Goel, Dr. Prakash, Dr. Michael Cheetham, Dr. Preetham, and Mr. Om Irani will be joining us. So the glimpse of Aditya Jyot, which we started in Dadar in a big class in 1990, and we moved to Badala in 2004, and we are the biggest eye hospital in Mumbai. And this is one of the surveys in 2001 and later a few years back. By the Outlook, we were ranked number 1 in Mumbai and number 5 in India. And I think that's a great thanks to my entire team. And the most important I am happy is the Legal Digest survey, which is the as a trusted hospital and is reviewed by the patients where they say that we can trust the doctors out there, which is what every day and it's there in our vision and mission, where we want to serve every patient who walks in like our own father or mother and make sure that we work with 100% patient satisfaction with zero error. And this is again another survey we ranked there, and we also ranked number 1 in the cleanliness of the hospital. And recently, in the Polytechnic of India and Government of India, we have also registered a program called WASH, where they are training hospitals to get recognized for making sure that the COVID precautionary measures done. We have hand sanitizers, dispensers, not contact thermal scanners, and the shields for examining the patients. So this is just to say, I think we have public, we have the Indo-American Chamber of Commerce members who are not doctors, and we're not having, we want to make tell that every hospital, the our India Film Society, the American Academy of Cinema, giving guidelines how to run a clinic during COVID. All of us are working from March end, and I think that's how this is one of the Dr. We can't recognize people where we, I think it's myself, wearing the indirect scope with the protective gear and N95 mask. This is a tough thing. We make sure the patient also wears the mask, and that's the clinic, so that we make sure that we protect ourselves, we protect every patient, and we recommend patient relatives to stay outside unless they're a small child for some urgent problem, and make sure that we take all precautions. And this is in the operation theater. And then this is the, we make where the entire hospital is clean after the patient comes and goes, where with the disinfectant, before starting the service, and you can see our staff. And this is actually, I think, in the, even in the foundation clinic in Dharavi, we do the same. You can see the N95 staff, and where you can see the small picture where I'm standing in the blue, which is a thick PP because Dharavi was the problem. And I'm glad I'm working with Dr. Ramana. We are working with this thing called HealthQ, where it's a triad system for COVID, where it will have in the computer the diagnosis which needs the new paradigms, so that the patients will have the all the detail, including the history, and then whether the patient has a health group which has which you can connect the blood test, you can connect the temperature, you can connect ECG, but specifically for the COVID, we are actually having the temperature recorded, history, and it will give it has a logarithm which is not AI, but it has a calculated indication whether it's advisable for the patient to be taken in, or he has a high risk of COVID, and then he has to be referred to a COVID hospital. So this is how, and we can also have the pulse oximeter, so which will, which all will be taken and see what is the risk for the patient also, and for the doctor also. So we can have this an integrated instrument, and we are working on it. We are also waiting for our ethical company approval, and we are doing that in the interest of the hospital. So I think with this, I introduce my good friend, I mean my brother, who is Dr. Prakash, He currently leads the international programs and global health and is the international director of the NIH in USA, founding president of the Global Identity Consortium, for which I am the Secretary General, and we have Dr. Takeshi Iwata, who is the president of the Global Identity Consortium. And based on this, we had several meetings in Mumbai, Delhi, and various parts of the world. I'm just telling Mumbai because we are in India now. And he served as the first director of transformational medical technology and a pioneer scientific research and product development program. He also worked as the COO and executive vice president at Amat International, president and CEO of Metastatin Pharmaceuticals at Pfizer. He served as the project scientist for the largest selling product in the world, the fluconazole and voriconazole, used by millions. And he earned a master's and PhD in microbiology from the University of Urbana Champaign, and where even our Raja done an MBA, and he also done an MBA and received postdoctoral training in biotechnology at and then he medical school in CDC in Atlanta, recipient of several awards and honors in the US and abroad, and include fellowship and AAS awards. He is the director of the Office of International Program Activities, NEI, NIH, which is and he's a great motivation for me because we want, as Rajesh started saying, that most of the research is done in the US, and I'm happy people like now you will hear Mike Chetan, Dr. Prakash, who encourages all of us to do research, and the Indo-American collaboration, which is happening for several decades, signed by both Prime Minister and the President of the federal US, which is, I think, working, and that the federal government gives the grant to the, of course, after peer review. Similar thing by the Department of Biotechnology, Department of Science and Technology in India. And I think over to you, Dr. John.
All right, thank you very much. Let me go to my presentation. Okay, Ms. Tripti.
Sir, we could see your presentation.
Okay, great. So first of all, thank you very much, Dr. Natarajan, for such a kind presentation, and I mean, as well as introduction. You are always very kind to me and very partial to me in most respect, and I admire your energy and admire your work. So let me start out by thanking, first of all, Rajalakshmi ji, who is alumnus of my university here in the US. So good morning and good afternoon to all of you. And if Mr. Boman Irani were to be here, I would have said what Shul Jadu could help you. You know, he's just, I'm a big fan of his movies, actually. And my wife and I, we make sure that we watch all his movies. So whenever he shows up on the screen, I'm going to do a what Shul Jadu piece. So many of you know where that is coming from, which movie. Most importantly, what we want to do here is talk about some of the information that are very much needed, required, and we all work on these things together. So, as you see here, my first, the title slide, this has, my own background working with Dr. Natarajan and his team, especially in the slums of Mumbai. And some of these pictures were taken from my previous visits. So it's, Dr. Natarajan said that, I inspired him. In fact, he inspires his team members, Radhika ji and his workers in the slum. They're the ones who actually are the source of inspiration. So thank you all for inspiring us all around the world, what we do in the area of research. And I just want to make sure here that certain opinions that are expressed here are my own and not of the government of the US, and the US government does not bear. So we all know, and since I'm the starting at the first speaker, I have to highlight this actually. According to the World Report on Vision that was just released a few months ago, uh, there are at least 2.2 billion people around the world that have vision impairment. At least 1 billion have vision impairment issue that could have been prevented, which is a very, very important piece of information for people like us who work at National Institutes of Health. And so we work with that pretext that there are a large number of vision-related issues that could have been prevented, could be prevented. So 90% of the global burden of eye disease is shouldered by developing countries. Of course, India contributes a huge, unfortunately, huge portion of it. And there are many treatable diseases that go undiagnosed. And there are amazingly number of centers in India that are dedicated and working on this issue. Comprehensive research strategy is needed. International research collaboration in this field is so important because the sheer large number that actually brings us together with a common goal and interest, and we all have to work together. And organization like the Indo-US Chamber of Commerce obviously can play very important and significant role in building these collaborations. So a wider collaboration is needed, certainly in the area of research to advance the high quality science in many areas of vision research, and that leads to the improvement in standard of care. So let me tell you all about my organization. So the picture you see here is called National Institutes of Health. This is just outside Washington, D.C. in Bethesda, Maryland. And it's an agency of the U.S. government, very much like Indian Ministry of Health. We call it Department of Health and Human Services, which I and my colleagues who are present here, Dr. Peter Raman and Mr. Mike Cheatham, we work for the Department of Health and Human Services in general. And the NIH specifically, the mandate is to conduct and support medical research to uncover new knowledge that will improve the health of all Americans. And here is the highlight, and the human condition throughout the world. So it is in our mandate to actually work and develop new knowledge that improves the health of not only just Americans, but the human condition throughout the world. And the National Eye Institute is one of the 27 institutes and centers that are dedicated to research specifically for eye diseases. So here it is. I've shown you there are many institutes here, 27 of the institutes in the center, and National Eye Institute here. That's one of the institutes. It all makes National Institutes of Health. So in terms of mission, and I work for the National Eye Institute, and our mission is to conduct, support research, and training. Training is a very important part of what we do, not only for today, but for the future. In dissemination of health information programs that all lead to respect to blinding eye diseases, anything that relates to visual disorders, mechanism of visual function, preservation of sight, any health-related issue that creates it, that are requirements for the blinds. So we completed our 50th year just a few years ago, and this mission and program marches on. And any advanced knowledge of the visual system and health and disease is very high and the highest priority. We help prevent and treat eye diseases and other disorders, and that in turn improves the quality of life for people of all ages. As you know, if you're born in this world, most people have eye issue, whether it's childhood eye problem all the way to the aging population. And just this year, our appropriation budget is $824 million, just dedicated to eye research and training. So, how do we view our international collaboration and our international research? Well, we truly believe that global science is interconnected, and we are involved in global eye research. We seek scientific opportunities. We share, as Dr. Natarajan said, many of the organizations and communities that he's involved in. I'm working with him. We share priorities, support unique presentations in patient populations and opportunities in scientific research. We help specifically the U.S. domestic grantees, people who work who are researchers in the U.S. and U.S. universities and institutions when they want to expand in international research. They want to do international collaboration. And we form partnerships with scientists, governments, companies, NGOs, and any organization who wants to do research and training in eye diseases. And here's something I want to highlight, and that anyone from any country, this is very specific and unique to NIH programs, that anyone from any country around the world can apply for an NIH grant. And there's a link there that one can look into. So just to emphasize that point, from anyone, literally from anywhere in the world can apply. That's nice. Biomedical science grant to do eye research. And by the way, as Raj Lakshmi said, that I'm not the one who gives the grant. It's a peer review process. We are supporting the process. We are supporting the organization, and we facilitate the information gathering, information processing. And it's a very peer review process conducted by very highly qualified reviewers. So now coming to India, Indo-US collaboration on vision research goes has been going on for a very, very, very long time, actually. And you see a picture here. This is the 2005. And in this picture, you see Dr. Maharaj Khan, who was the secretary to Department of Biotechnology of India, and the science counselor, Kamal Trivedi, signing a formal agreement on NIH campus on August 24, 2005, with the then NIH director. And that led to evolution and happening of many specific grants, which I list out here. And that started the first wave of a jointly funded program, which we call it NEI collaboration with the Department of Biotechnology of India. And that has resulted into several very highly specific and good programs that provided not only very academic understanding of eye research and vision issues, but also it has led to many, many programs in applications and use of this information in, not only just India or US, but all over the world. And several organizations from India as well as the US, some are listed here, have participated in this program. For example, as you see, the key centers like Shankar Nethralaya, LV Prasad Eye Institute, Arvind Eye Hospital, the National Institute of Nutrition in Hyderabad, Shroff Charity Eye Hospital in Delhi, are working with some of our leading institutions such as Harvard and University of Washington University, Cleveland Clinic, Hyderabad, working with Harvard again, and University of California and San Diego, Shroff working with MIT. And these programs, most of them are actually continuing and are still really producing some very, very high quality work. And Dr. Natarajan knows that under his leadership at All India Ophthalmology Society meeting just a couple of years ago in Indo, many of this work was presented. And actually, it is presented almost every year, some form or other, where we discuss not only just science, but the applications part of it. In the second round of the Indo-US collaboration, we launched two large programs that related to national priorities in both the countries, US as well as in India. And their programs were in glaucoma, now our leading institutions, like Harvard, working with Shankar Nethralaya, and Cleveland Clinic, working with Vision Research Institute, also at Shankar Nethralaya, working on such issues. And we currently have the third round of this program ongoing, and it's a very important piece of information that the next grant submission deadline is November 9th. And I would highly encourage you to disseminate this information to not only just to all attendees, but you're asking attendees to actually inform your colleagues and your peers, everyone that this uh, application is open at this point, and I've given you the NIH link. This is a very nice program that both the governments are actually jointly funding this. We fund the U.S. Institution and investigator, and the government of India is committed to funding. That's DBT, and government of India is committed to funding Indian or PI organizations. So please disseminate this information. Please inform your peers and your colleagues that this application is due on November 9th. And so in addition to the research programs, the collaborations, we at National Eye Institute, we are also a large training program. We have been training scientists, pretty much every generation. We have trained a large number of Indian scientists who are who not only made difference here in the U.S. when they were working with us, but a large number, a majority of them, as a matter of fact, have gone back, and they are leading organizations in their respective country. And India, as you can see, with this number of people that who have gone back, India constitutes a large number. Currently, we are training a very good number of Indian scientists, out of about 88 or so of the foreign postdoctoral fellow, 14, 15 of them come from India. So this association continues not only in the previous generation, but this and the current generation, but also it will follow the next generation, because these scientists, they become really the opinion leaders of tomorrow, and our association continues the next generation. So in terms of final thought, I would like to actually give you a certain takeaway that National Eye Institute supports the entire research continuum, which goes from basic discovery, basic research and science, all the way to trials, that practice, anything that relates to research. We are interested, we are part of it. There are many opportunities that we can actually tap into. They are from mechanistic-based treatments to concerted and focused efforts from basic discovery into clinical application, and that are supported by Indo use program or individual programs or training programs, as well as the research programs. And since we are in this pandemic at this point, unfortunately, and I would like you to know that NIH is really at the forefront of COVID-19 research in terms of developing diagnostics, therapeutics, and vaccines. And we are also supporting this program, various forms or other. And the National Eye Institute team is looking forward to the opportunity to work with global organizations, including the Indian organizations, in developing programs to prepare for any pandemics in the future. And we are always very impressed with the enthusiasm of Indian researchers, Indian organizations, that of course includes Dr. Natarajan and his institution, who are supporting this specific program. But in addition, all other Indian organizations who have actually made a big difference in working with the National Eye Institute. Of course, that includes Shah Eye Hospital, Arvind, LV Prasad, Shankar Netrale, and many other organizations in Chitrakoot, and many organizations that are part of our daily life working with us, and many other programs. So I want to thank you very much. I like to say that good eye research anywhere is good eye research everywhere. So if you develop something, if you do something really nice, of course the whole world uses it. The U.S. Gets used in the U.S. If we do something, we share it with you. So let's continue the good work and the passive collaboration, and we are very excited and enthusiastic about our work in India. So I want to thank you very much. I'm giving you my contact information. and I'm available to actually work with anyone who has any new ideas. Thank you very much. Dr. Natarajan, thank you very much. This concludes my presentation. I'm open for any question.
Yes, thank you, John, and it's really always great listening to you, and glad that you're also part of you included me in the World Congress of Ophthalmology, which was held by way of the 7,000 doctors from all over the world. That was in June, as part of the International Ophthalmology, where we mentioned about research collaboration. We brought scientists from New York and talked about COVID and what's COVID research going on. Maybe I like to have one question. What do you think about the vaccine developed for COVID? I know it's not exactly the topic which we are discussing. Right? And any other question anybody wants to ask?
So Dr. Natarajan, as you asked about vaccine, and obviously, as you know, NIH is really the forefront of vaccine development, and we essentially have our involvement in pretty much all major vaccine programs that are ongoing in the US and worldwide, whether it's Moderna program, AstraZeneca program, Pfizer program, J&J program, and some way or fashion, not only just basic research, but we are also participating in clinical trials. And our leading scientists and researchers, including Dr. Tony Fauci, who I had the greatest honor of working in my previous life, they are literally the forefront of the world, actually, in working with our government and other organizations. So NIH is very much involved, and these things are happening pretty much daily. And I'm always eager to watch the evening news, the day's development. And I'm pretty sure that with all this hard work people are putting in, this will all bear fruits just in a matter of a few months. So, like you, I'm always very hopeful, and we look forward to benefiting from the overall NIH involvement.
Thank you, John. Any other question? Anybody wants to ask some question? You can stop sharing the screen.
Okay.
Yes. Rajesh, you want to ask something?
Yeah, can you hear me?
Yes, I can hear you.
Okay, I mean, whoever want to actually, due to COVID-19, have you seen any particular problems in eyes in general?
Yeah.
Affecting eyes, I'm talking about COVID patients.
Yes, actually, I'm pretty sure Dr. Natarajan is a clinician, and Dr. Ravi Goel, they're in a better position to answer such question. And they actually had, obviously, in their presentation. So let's hold off to that until Dr. Goel is presented, and we can address that issue at the end of the session.
Okay. Good. So in the meantime, we'll call for the next speaker. So I'll just show the slide. Can I see the full screen? Can you see the screen?
We're still having John's introduction.
I know, but I don't know why I'm not.
You can see your screen.
No, I know, but I can see.
Maybe you should try stop share and then change.
Yeah.
Okay. Okay, yes. I don't know. Okay. So next, now I show the screen. You can see the screen now?
Yeah. Yes.
Next, we have, yes. What? Okay.
You could go to full screen? Yeah.
So next we have Dr. Peter Rajaman, PhD, the key advisor to the US Secretary of HHS and the US Embassy in India on matters involving health and biomedical research in South Asia. Responsible for in-country representation, monitoring, and coordination of the policy, programs, and interests of all HHS agencies over a broad portfolio spanning health policy, non-communicable and communicable diseases, health safety and security, and research and innovation. Initiated research programs and policy at the U.S. National Institute of Health, National Cancer Institute, where she received the Director's Award for Exceptional Leadership Fostering Cooperation in Cancer Research and Scientists in the United States and India. Her research on the interaction between genetic susceptibility and environmental factors in cancer has resulted in over 130 peer-reviewed publications. And we all know as an academician, it's not easy to have so much of peer-reviewed publication. Expert advisory member for various international bodies, including National Commission on Radiation Protection, WHO, and the Lancet. Holds a PhD honors in epidemiology from the Johns Hopkins University, and an MSc in Environmental Health, University of Washington, and a BA in Biology honors from the college. So I stop sharing my screen. So, and over to you, Rita.
Thank you so much, Dr. Natarajan, and thank you to all of you for inviting me to join this really important conversation. So, we've already heard quite a bit about the US-India collaboration on vision, which is really one of the most stellar programs. So I won't talk much about that. I think what the organizers had asked me to talk about was a little bit more broadly, what are the US and India doing in the context of COVID cooperations more generally. And so I'll do that, but of course happy to answer more specific questions later if you have them. So, just stepping back and looking at this in context, this is a really unusual situation that we all find ourselves in, where no matter who we are, where we are in the world, we're all facing a common challenge. And a challenge, there's really no roadmap, there's no known solutions, and we're having to figure this out together. In fact, if we look at the numbers just today, there's already more than 27 million confirmed cases, and the US and India are in fact the two hardest hit countries at this time. However, what I would like to point out is, yes, we're facing this common challenge, but we're also face this with a common hope. And I would say one of the biggest things that we have going for us is the Indo-US collaboration. And in fact, our ability to work together now on COVID-19 builds on more than 70 years of partnership. So in fact, the health collaboration is one of the oldest, most productive parts of the entire US-India bilateral cooperation. And in fact, a lot of people don't realize that it was very shortly after India achieved independence that some of the first grants and technical collaboration and technical assistance was on health. And in fact, this is a tradition that we continued. And in fact, over the past 20 years, more than 1.4 billion US dollars in assistance have been specifically towards health priorities in India. So I'll today, obviously the US government has many different agencies, but today I'm going to concentrate on the agencies that are within the Department of Health and Human Services, which we all represent here today. And of course, the three that many of you know very well, of course, our beloved National Institutes of Health, which is well represented today, but also the Centers of Disease Control and Prevention and the Food and Drug Administration, all who have a very strong presence here in India. And that's just the agencies, there's another 8 agencies that do actually have investment in India in other ways. But these really have the biggest portfolio. And all of us have worked very closely with Indian partners, including the Ministry of Health, the Department of Biotechnology, the National Disaster Management Authority, and many other public as well as private sector partners. So I will say that a long history has been certainly with the government, but very often with private sector partners as well, looking to build systems to prevent, detect, and respond to epidemics, to strengthen the regulation of life-saving drugs and devices, and very importantly, to find the solutions using joint research and development, as you've heard today. So I'd like to spend a few moments talking about some specific examples of how some of our past investments really rolled in when we had to face the COVID epidemic together. We had a question on vaccines, and so it's pertinent that one of the first examples I really want to highlight is a 33-year-old program between the US and the India known as the Vaccine Action Program. And this really has been one of the most successful programs that we've had together, yielding a lot of success stories. Some of you may know that India's first indigenous vaccine for rotavirus, which has gone on to really already save hundreds of thousands of lives, was developed in a partnership through the National Institute of Allergies and Infectious Diseases, as well as DBT and ICMR, the Indian institutions that you know well. And so this framework that already exists has, very easily been used to address the COVID vaccine as well. So as Dr. Prakash rightly said, HHS and NIH, in terms of the research part of it, have been very, very involved in the vaccine development globally. And one of the ways that we've specifically done this here in India is through the Vaccine Action Program, to have a very specific advisory committee that was on candidate vaccines for COVID specifically. And partners from both the US and India, particularly Indian vaccine developers, were invited to come together for this, share some of the details of the program, and request help from the technical expertise, both at NIAID and in the US. And this has been a really, really great conversation. Shortly following this, you already heard of course, one of our research stars, Dr. Tony Fauci, who needs no introduction, actually spoke to a seminar that was organized here by the Indian Council of Medical Research on the importance of vaccines, but also on the importance not only on the development, but on the ethical development of vaccines. How do you develop vaccines so that you're doing them in the most rigorous scientific manner? And how do you ensure that access is equitable after that? So that was, again, a very nice conversation that was hosted by ICMR with NIAID and several other international partners. Many of you, of course, have know our FDA and have probably worked with them or put some of your products through them, perhaps. So they continue, of course, to ensure the safety and quality and effectiveness of food and drug products. But within the context of COVID-19 here in India, they've worked closely with their counterparts here at the CDSCO to look at some of the newly emerging products, certainly sharing what we are authorizing in the US in terms of new diagnostics, new therapeutics. But they've also been working with some of the more unusual ministries for FDA, such as the Ministry of Ayush, in order to help prevent the marketing of unapproved products that claim to mitigate or cure disease when we don't have the evidence base for that. And then finally, when it comes to infectious disease, I'm sure in terms of surveillance systems, etc., many of you know the Centers for Disease Control and Prevention. And of course, they spent several decades building up systems to prevent, detect, and respond to disease all over the country. And when this epidemic emerged silently, really, in December, CDC here was already tracking it, and had a sense that we were going to have to come in a major way to strengthen what we already had and deploy that for COVID response. So in fact, the fact that we had hundreds of workers that had already been trained on the front line on contact tracing, the fact that we had people who had gone through the epidemic intelligence service on how to create new surveillance systems, all of these highly skilled people, as well as frontline workers, were very, very quickly deployed into COVID response. And I think even systems that you wouldn't necessarily think of, so we had an active surveillance system for antimicrobial resistance, for example, or looking at hospital-associated infections. Certainly of concern to the eye community. Those systems also have been deployed now, not only to ramp up infection prevention controls, but also to, at the same time, disseminate the latest in infection prevention controls specifically for COVID. So I'll stop there for now to allow questions on any of these specific topics. I will just, of course, say there are other institutions such as USAID and our Indo-US Science and Technology Fund that are also funding work on COVID and have also been doing great work. So all in all, very robust program that we have together. We invite any of you who are interested in joining any part of these to please do so. We are open to new partnerships and we would welcome that. Thank you so much.
For the wonderful overview. And we are a few minutes late, but I think we will have the questions at the end. I hope you will be there. So, and I'll again show my screen so that to introduce the next speaker. So you can see the screen?
Yes.
Yeah? Yeah. So the next is Mr. Michael Cheatham, currently with the Fogati International Center from the National Institute of Biomedical Imaging and Bioengineering at NIH, and works in the office of the Director, providing expertise on international scientific engagement, strategic planning, and developing new mechanisms to engage external partners. We launched the partnership with the Bill and Melinda Gates Foundation on developing a generic platform for smartphone-based diagnostics. Served as editor for the Interagency Working Group on Medical Imaging, a roadmap report, worked at the American Association for the Advancement of Science as the Associate Director for International Research Collaborations and the Director of the International Science and Technology Partnership Program. While at the AAAS, Cheatham also served as the head of the U.S. Office for the Indo U.S. Science and Technology Forum and headed the U.S. India Science and Technology Endowment Fund. 20 years experience building and managing international partnership in science and technology. And with this, I go in case Mr. Bowman has logged in, I apologize to him for the little delay. So I talk to you. I'm just stopping my screen. So, Mr. Michael Cheatham, you can.
Thank you very much, Aditya. And thank you to the organizers. Let me just share my screen here. Let me know when it shows up. There should be a title page. It's really a pleasure to be here. It's been a long time since I've engaged with India on a day-to-day basis, and it's always a pleasure to come back, even if only virtually. I'm going to talk a little bit about the U.S.-India biomedical research landscape. It will build on what Peter has told you, but a little bit more focused on NIH in particular. And finally, I'll end on some COVID-19 information and some practical advice for for next steps. So, U.S.-India technical collaboration, as President noted, is nothing new. It goes back to the independence of India, and it has produced some remarkable achievements over the time. So in the 1950s, the Green Revolution through public authority funds, and the land-grant colleges, IIT Kanpur, the first NASA-ISRO collaboration on satellite, deployment of satellite uses. 1987 saw the Vaccine Action Program. Towards the bottom of this screen, in 2000, President Bill Clinton came to India and launched the Indo-US Science and Technology Forum, which was essentially a small binational science foundation with the goal of promoting mutually beneficial cooperation in science, engineering, health, and also education, training, and culture. But this wasn't all. The U.S.-India technical collaboration continues through a high technology cooperation group and a strategic partnership. And in 2005, I highlighted the National Eye Institute DBT agreement on vision research. It spans agriculture, again with civilian space, energy, security. In 2009, the government's created a science and technology endowment fund to support early stage commercial ventures, building on collaboration, engineering collaboration. And in 2015, when I stopped working with India on a daily basis, the U.S.-India Health Dialogue was launched, and it continues to this day. This is a highly selective list. There are dozens and dozens of agreements, and the ones listed here are simply the ministerial level agreements. They're certainly not comprehensive, and they don't go down to the individual institutes. So this is a relationship that's both valuable and well known. I could probably stop my talk right here and refer this audience to an opinion piece submitted by the Indian ambassador to the United States just a few weeks ago on August 24th, noting that the very mature U.S.-India healthcare partnership will be a crucial asset in the battle against coronavirus. And again, this is building on our shared priorities and our long history of cooperation. But what can I do to put a slightly finer point on this conversation? I will talk a little bit more about NIH's role in particular and how NIH collaborates with India. So I took a snapshot of India using a tool called World Report. In 2019, the NIH supported 7 grants to a lead organization based in India. This sounds like an impossibly small number until you recognize that there were over 315 NIH-funded research programs that involved Indian research organizations. This is simply an administrative function. Over 186 Indian research organizations were collaborating last year on 176 unique NIH projects. And of the 27 NIH institutes that Dr. Prakash noted, 24 of them make extramural grants. 19 of those 24 were active in India in 2019. So how does this compare over a period of several years? So I plotted using World Report an analysis of the number of grant records involving NIH funding and an Indian research organization starting in 2015. We're looking at about 200 grant activities. And that number has consistently grown over the years. And I don't yet have numbers for 2020 yet, and the 2019 numbers have not been finalized, so this is somewhat speculative. And the number of institutions, which you can see in the red line, has also grown significantly. The axis on the right is the scale for the number of institutions. It's gone from about 100 organizations in 2015 to almost 200 organizations today. So the NIH is separated by institute, and this is a breakdown of which NIH institutes are active in India over this same 5-year period. I've highlighted the National Eye Institute here. It's in this green sliver. As you might expect, the National Institute of Allergy and Infectious Diseases, much in the news today, and Tony Fauci's institute, is responsible for the lion's share of NIH engagement in India. So who are the Indian institutions who are participating through NIH-funded research? And again, using World Report, I plotted the 60 or so organizations in India that have had 5 or more collaborations with NIH-funded investigators over the past 5 years. And as you can see, the Public Health Foundation of India is number 1, BJ Medical College, AIMS, YG Care, Christian Medical Contour. These 60 some odd organizations are responsible for about 70% of India's engagement in NIH-funded research. So now I will turn specifically to COVID.